Hi, everyone. Welcome to another workshop hosted by Medical School Headquarters. My name is Courtney Dunford. I was a prior director of admissions at a medical school. I've been with Dr. Gray and his team for a little over 3 years now, which time flies when you go in cycle years. And I am joined by Kristen, who was one of my prior colleagues, actually. So, go ahead and introduce yourself.
Hello, my name is Kristen Anderson, and I joined medical school headquarters full time, like middle of April.
Mhm.
Prior to that, I was a director of admissions and an assistant dean of admissions at a medical school. And before that, I was a pre med advisor at a local university. So, all in, I've been working in pre med school admissions for about 13 years, and
Yeah.
I'm happy to be here.
Yeah, it's nice that we have a very small, selective team, but all of us come kind of bringing holding of positions, running of programs from kind of both sides. And so hopefully our information and our wealth of knowledge is helpful to you as you try to best prepare. Today, we're going to be kind of handling a mock interview. We have wonderful participants who are willing to let us put them on the spot and ask some questions. The best way to prepare for interviews, and Kristen, hopefully you agree, I would say is mock interviews. You have to start verbalizing your responses to these questions. You don't want the first time you hear an ethics-based question to be in the interview room where you don't know how to navigate it, or not fully understand what they're looking for, why it's important, how careful with wording you should be, and things like that. So since we've had other workshops that lay out kind of the context of the interview, and some of those strategy points, we'll just kind of gloss over those at a high level again for any of you who have not had an opportunity to attend or go back and watch one of those recordings, just so you kind of know what we're talking about. We'll bring you up to speed really quickly, and also hopefully tip off our two participants who can take this into account as they're practicing their answers. So, the point of the interview and when it happens, kind of what part of the process are they in when they make it to the interview?
What part of the process?
Yep.
So, I mean, they are in. I mean, interview season is anywhere between, I would say, as early as August for some
Mhm.
schools, through all the way through May, maybe even
Mhm.
June for some schools, depending on, how they're structuring their cycles. And one thing to be mindful of is that many schools, most schools, I think I can say, work with rolling admissions. So the later
Mhm.
you apply, there are actually fewer interview spots available to you, which is why we stress, applying early.
Mhm.
But at the application point, you've already made it through the initial screening. You've
Mhm.
done your primary application, you've done your secondary application, they've reviewed everything, they've decided they like you to invite you to an interview. Interview spots are limited. They're quite limited at many schools. So if you're holding an interview spot, that means something. It
Mhm.
means that they have liked what they've seen, and some might argue that the seat is yours to lose at that point.
Yeah.
That so yeah, that's kind of where I would say where we're at in the season. And
Yep.
it this is a long part of the season.
It is.
It's the hurry up and wait
Yep.
part. So
Yep.
yeah.
It's really hard for a lot of candidates to know, did I do something wrong? Why haven't I heard anything? It's been a month since I submitted something. What do I need to be doing in the background? Well, this, because you don't get to necessarily pick, once an interview invite comes in, sometimes there's only two options. I can either pick 3 days from now, or I have to wait until the end of October. You want
Hmm.
to be prepared to jump on whatever you can get as soon as you can. Like Kristen said, the farther we go, the more the cycle has already kind of arranged itself, I would say. We have both served as prior directors of admissions at medical schools, and so we can tell you this process is very involved.
Mm-hmm.
It takes a lot of work, and rightfully so. We want to make sure we're thorough in the review of candidates, and when you've got 4 to 10,000, it's pretty arduous on the back end. So let the process play out. It's a good thing if it takes a little bit of time. That means they're actually reviewing candidates. But like Kristen said, if you make it to the interview, this is not given out by charity. Um, we only get to seat the class out of who we've interviewed from the interview pile. And so we're not going to move anybody into the interview pile where we already have enough information that would lead us to believe no matter how well you perform in an interview, we're not going to select you for the class. And so there is a lot working in your favor at this point. They've got a lot about your academics. They've got a lot about what you stacked on top of each other leading up to this point, letters advocating for you, and at least kind of a high level sense of where you feel like you fit in at their school, or what's been drawing you, where some alignment points may be. So with that, we can kind of make an initial assessment. Can this person handle the academics first and second year, which are pretty clearly laid out for most schools? They've got to teach you the science of systems, disease, clinical skills, pop health, distinctions in research or anatomy. You're doing student-run clinics, standardized patients, clubs and organizations, potentially taking on a leadership opportunity, studying for boards, and then sitting for boards. And that's your 2 years essentially in a nutshell. It goes by very quickly. So your academic record and your primary can give us a pretty good sense of your academic capabilities, with what you were multitasking with, again, how high your load can go when you're combining things, how you perform, what foundational coursework you've taken to kind of hit the ground running. And then from there, third and fourth year still matter when it comes to graduation, right? I think in the interview, we're kind of looking for things that will help us identify good bedside manner, right? Just preparedness for third and fourth year. One, yes, being at the school, are you a good fit? But what are some attributes that you feel like your school or you in general kind of look for candidates during the interview for kind of
Good question. Yeah.
personal? Yeah.
So first and foremost, I would say professionalism. I mean, I think this career carries, a level of professionalism and demonstrating that you can be professional, and because that's how you ought to behave at the bedside. And so professionalism, I would say, communication is a huge piece. Communicating with people with varying levels and backgrounds of understanding with regard to medicine and their diagnoses and things like that. So can you communicate clearly? Can you articulate what you're trying to say? I think there is, kind of piggybacking on professionalism, a level of respect, holding respect for, others' opinions and beliefs, and understanding that they may or may not align with yours, and that's okay, right? And they get to believe what they believe and make the decisions that they do. I would also say team player, assessing how well do you work in a team, because as one of our associate deans used to always say, medicine is a team sport. You don't go through this alone as a physician. You are a leader, yes, but you don't make all the decisions necessarily. You don't have all of the information. There are times when it makes sense to involve others or refer or, pull in other information and other players in patient care. So I think those are the ones that come to mind, top of mind, that I'm always looking for.
Yeah. I think a lot of this, so we just described kind of what the first 2 years look like, how we can kind of assess that. There's not a lot of time in the first 2 years to take somebody with kind of zero social awareness or developed communication skills and bring them up to that high level of proficiency like you're talking about, and being able to navigate really complex conversations, different emotions, and know how to navigate, adapt, and work within a team, everything has a ripple effect, right? And so, resilience, emotional maturity, right? That
Mm-hmm.
professionalism, communication skills, that level of social awareness, critical thinking ability, which is kind of key to be able to navigate so many moving pieces, and know how to work a problem as it unfolds, are pretty imperative to already have developed to an average to preferably above average aptitude when you come into school, so we can focus on the academics of the first 2 years and give you some guidance there. But then you need to be able to have your soft skills developed enough to plug and play once you hit third and fourth year. And we can probably both attest to, sometimes professionalism problems. That's where they're going to start popping up, is because individuals may feel a little bit or be a little bit underprepared to handle some of those dynamics at functioning hospitals or somebody's private practice, where you're seeing their patients as the provider for the day and talking to people about some intimate health issues or things like that. So admissions has kind of gotten front loaded. The interview now very much is about that. Let's try to assess your level of development in some of these attributes. You need to come in with them. I need to see evidence of them. So a lot of the times where I felt people got most off course, students getting most off course with how they're interpreting the interview, is I'm looking for those qualities and characteristics just the same as Kristen. And I don't want to ramble. I want to show them I'm decisive, I'm a leader, I want to get to it so they know I know what I'm talking about. I want to come across as confident. And if I'm looking for critical thinking ability and emotional maturity and social context and awareness, sometimes the most succinct answer isn't always the most helpful. Would you agree with that
I
in
would
trying
agree.
to
Yeah.
evaluate? Yeah,
Yeah.
yeah.
Yeah. Giving examples, really exemplifying what you're trying to say and connecting. We all connect through story, right? We're human.
Mm-hmm.
So if you're trying to, make a point and you have an example experience that really kind of shows what you're trying to describe, pull those in.
Mm-hmm.
And so yeah, not just saying, yeah, I like working with patients
Yeah,
and
yeah,
just leaving it that. That's not helpful.
yeah, yeah. We can teach you standard operating procedures, laws, processes. We want to see what it looks like for you to navigate within the bounds of those things. How do you work a problem if you have to abide by them? Not just that you know them. Help us get to know your thinking and what it would look like if we stick our name on your white coat for you to navigate those types of things. So that kind of brings us to the last kind of high level point. Yes, there's different formats of interviews. There's traditional, there's MMI. I think that's more of a preference and resource availability thing for schools. They're still looking for the same thing. But if I'm trying to glean, if you can critically think, if you're emotionally mature and professional, if you have good communication skills and levels of social awareness, what types of questions should I ask you if I only have 30 minutes? Probably ethics-based questions, right? What are some of the other ones, I guess, most common that you guys would ask or you do ask?
I think there's what we kind of call the more traditional questions, the kind of getting to know you type
Mm-hmm.
questions, situation based questions, like tell me about a time when. I think
Mm-hmm.
those can pull out some really concrete examples of experiences that we can draw certain information from. Those ethical scenarios certainly helped you display as an interviewee your critical thinking, because you can talk through kind of the different avenues and talk through how you make a decision.
Mm-hmm.
And then, of course, some of those traditional questions around, like, why do you want to be a doctor? Why do you want to come
Mm-hmm.
here? Have you done your homework? Have you really thought about this? And can you articulate your reasons for these things?
Mm-hmm.
I think those all come into play here.
Yeah. I think a lot of candidates, they express to me that they are worried about those traditional questions. And so, we'll have an opportunity to see somebody kind of work through that. At the end, if you guys still have questions on, okay, well, how have you seen, give me an example of somebody who answered that really well, or what would you do in this answer to kind of perform? We can kind of cover and give more concrete examples of how you can attempt it, and then why it's valuable to attempt it that way. Um, Not everybody has to be the same person. Usually there is not a correct answer or side that you need to land on. You can have opinions. I'm looking for skill set development and levels of awareness in the interview. And so we don't have to agree on everything. And the interviewer hopefully is, removing some of their implicit bias if it is there, to allow you to have your own opinion on things. So it's not a verbal exam. It's an opportunity for you to highlight some of your soft skills that you've developed by being willing to have challenging conversations. Yeah, I'm willing to try to tackle that. And I'm going to be very careful in how I word my answer. So that's kind of what we've boiled it down to, bare bones, right? That's the information that we need. That's the point of the interview from a, kind of AdCom perspective, what we hope to get evidence of in an interview. You don't have to be the most extroverted person or anything like that, but we've got to have enough content to go off of that we can get a sense of these things. So as you're practicing at home or watching this or trying to prepare, just build out your answers enough and take these things into consideration so you can kind of work them or develop your answers to show this. So any other kind of core questions about the setup of the interview before we move into a mock portion? Feel free. This is not super formal, you guys. So this is meant to be a workshop. If you have questions, please ask them. It's totally fine. That's what we're here for. We do open Q&As every Wednesday, so we're used to getting very random questions if you need to, but okay.
So it looks like there are a couple questions here that maybe came through in the chat. First one from Nicholas. You guys mentioned you had resources or recordings. Where would we find these?
Mm-hmm.
Oh, and it looks like Emily linked that there. But yeah, we've got tons and tons of information on our website, on YouTube, on social media. There's all kinds of stuff there. And then another question from Madeline around how many mock interviews are recommended before the first interview / how many mock interviews do you see students typically participate in before a first interview? And does this number differ based on whether the interview is MMI or traditional? Trying to figure out just how much preparation before a first interview it looks like.
Yeah, some of this will depend on the candidate. Most commonly, I do see people do 3. I would say 2, 3, just because there are different formats. Traditional is different than MMI, even though the questions and what they're looking for may remain very similar. Because the MMI timing structure is so rigid and you're not flowing from one conversation to the next like you would in a traditional, it does feel very different. So at least having an opportunity to try both if you need to for the schools that you've applied to. Some people like to do school-specific ones and have multiple attempts to improve over time. Usually I don't see a one and done, I'll say that, but 2 to 3 because they'll come back better, and you definitely need at least one to have a baseline. You don't know how you're doing, and sometimes friends and family mean the best, maybe don't have the same. Share this with them, I would say. At least tell them what we told you they're looking for so they can evaluate you against that. But that's the most common that that I've seen. When I work with cycle students, my cycle students will do a lot, and then they'll go to our application academy and do more randomly in a group. And so they get a lot of coaching on this part of it because, as Kristen said, it's yours to lose at that point. They're obviously interested. Best case scenario, you want to be there and you're ready to go. That's a win. That's a seat stamped, done. I'm going to move on to fill the next seat. And so, yeah, I don't know if you have a different number that you get.
No, I would agree with that number. And I would add that getting, a variety of feedback, doing some practice with a number of people,
Yeah.
like Courtney mentioned, friends and family can be helpful, but they also really love you. And so they think you're great and you are, right? But they might not be recognizing where you could be, presenting yourself differently because they think that everything you do is awesome. Like I know I can't go to my mom for feedback on anything because she'll just say it's amazing. And I love that she says that, but also it's not helpful because I'm like, no, tell me what I did wrong.
Right.
So,
yeah. And we can remove a lot of the ambiguity without ruining or somehow compromising the integrity of the process. But you guys need to start getting words out your mouth because a lot of people are not used to, talking about their opinions on things while having to account for a lot of other things, or, putting themselves in some scenarios that we may put you in hypothetically in these types of things. So we can be pretty direct with feedback with the point of helping you address what you need to address and understanding why it's helpful to address it. And also sharing what you did really well. If you have a banger of a story where you're like, yeah, they're going to love this, and here's what makes it strong, we can tell you that too. So it's not all just bad stuff. We can really highlight and help you understand the good as well, and what you do really well, what should carry over. But it's usually hard to get started. Give yourself some grace, give other people some grace as they practice as well. And okay, anything else before we get going? I didn't look at the questions in the chat or anything.
So it looks
We
like
may get to some of them after too.
Yeah, and we can maybe take this one and then move on. So do you advise looking directly into the camera? Tips for this?
I'll let you answer. Go ahead.
So it's probably a lot the same. So
yeah.
What we don't want is you like staring at the camera and being very awkward and almost scary with it, because that's just awkward and it's going to make your interviewer uncomfortable. We don't want you, if you have notes, reading down, looking below, just try to be natural with it, and there are tips. You can actually, one thing that I do, because I have a tendency to wander with my eyes and it can be very obvious, is I will sometimes minimize assuming it's like on Zoom or something, minimize my window so that I'm looking at them right by my camera.
Right there. Yep.
It's right by my camera. And if I have notes I'm going to go off of, they're also right by there, so that it's not, dropping my head to look over here, or, that sort of thing.
Yeah.
So
I've seen faculty comfortable with both, of looking there, or wherever I'm at your screen, if you kind of maintain eye contact there, if you're looking to see my reactions or something like that. I agree. No weird angles, you guys. If you have dual screens, don't let the camera be like this and you're kind of talking here and I'm on your screen here, but the webcam is here. It's so weird. And don't do weird up angles.
Up your nose. Yeah.
Yeah. This, like what we both have, is acceptable, right? Don't do weird stuff. But yes, most of the time you would try to look at the camera without really getting in there, or you can look at the screen.
Yep.
Those are kind of your two options there. Okay. All right. Is our participant ready to give this a go and accept some feedback from us on the spot? Okay. All right. Let's do it. Okay. Hi, Whitney.
Hey, how are we doing?
Good. How are you doing?
I'm good. I'm a little nervous, but I'm excited.
Good. I appreciate that you're willing to attempt this. It can be very nerve-wracking, but growth happens in uncomfortable moments a lot of the times. And so you being willing to do it here, obviously we'll be honest with our feedback. It may somewhat differ here and there. There is a little bit of subjectivity there, and it's exactly what you're going to find on the other side. But I think at the core, we're going to be aligned on stuff. So we'll be constructive but direct, I would say, with feedback. Okay.
Sounds
With the
good.
point of helping. Okay. With the point of being helpful.
Hey,
Okay.
I want all the help I can get.
Okay. Good. Love that answer. All right. So then I'm going to pull up my questionnaire that I actually pull questions off. Kristen, you want to ask the first one? We can kind of rotate.
Sure. Yeah. So let's open it up.
Okay.
I would say with what's probably the most common question, and that is, tell me about yourself. Who is Whitney?
Yeah. So, hi, my name is Whitney Ribnick. I am currently a rising senior at Carnegie Mellon University. I am doing a double major in chemistry and biomedical technology. I originally grew up in Long Island, New York, and I moved down to Florida when I was 6. I've always really loved cheerleading and musical theater, and those things are actually kind of what drew me into medicine. When I was in cheerleading, I got injured and I actually tore my UCL, which was a little traumatic, but it kind of got me into this mindset of wanting to learn more and understand more about what was happening in my body, and led me down these rabbit holes of, ooh, what is medicine? And not only that, but I was inspired by all of the doctors who were working with me, especially as a young kid, all the compassion and patience that they brought with me. And this kind of led me into research where I thought maybe I would go into pharmaceuticals. But while I loved the problem solving and analytical aspects of that, I found I wanted something more patient centered, patient direct. So I ended up kind of exploring in different areas, going into clinical research and volunteering, and now I'm a medical assistant. And all of these different experiences have kind of solidified who I am and where my place is, and I believe that place is medicine.
Okay. Sounds like you have a number of interests. How does how does music kind of loop into all of this?
Yeah, I have been doing musical theater from a very young age. My sister actually majored in musical theater and kind of looped me in with her. And I've found that not only is it like a really great creative outlet and emotional outlet to be able to express myself in that way, but all different kinds of people do theater. So it's been great in this kind of like teamwork and diversity aspect to handle not only creative differences, but different life experiences and how we can balance those as a team to create this product that we're all proud of.
Yeah. Okay. Well, you've certainly chosen an arduous journey in wanting to become a physician. I'm sure you're starting to feel that now. I think especially post-COVID, we're hearing more and more about physician burnout rates and some of the negative mental health aspects of being this type of provider. So talk to me about your motivations. I know you shared a little bit about what initially introduced you to medicine, but talk to me about what continues to motivate you down this path. What draws you to this profession, and how might you go about mitigating the chances of you ending up as a statistic in the future?
Yeah, great question. So I think, first of all, I have had all of these experiences. Like I previously mentioned, I had this UCL tear that really got me into medicine and the science behind it. And as I got more involved in medicine, whether it be through research, volunteering, actually working at a hospital, I found that there's a tangibility and responsibility to medicine that I'm really drawn to. Being able
Mm-hmm.
to physically see the impact that I'm having on patients and getting to make those one-on-one connections, hopefully building community through my interactions, has been really meaningful. And to answer your second question as to why or how I will prevent burnout, prevent myself from being a statistic, as you said, is I already do a lot in college. I currently, I overload my coursework. I actually have 5 jobs involved in both cheerleading and musical theater, as I said, and I still get 8 hours of sleep. Um, So I've kind of learned how to not only like organize myself, organize my time, but also prioritize my mental health by I am a big fan of Google Calendar. I schedule lunch and dinners with my friends to make sure I'm seeing them. I actually have an ESA rabbit, who is also a big highlight of my life when I get to come home and see him. And having these like creative outlets through musical theater and like physical outlets through cheer has all been really supportive in me not getting burnt out. And I hope to continue these activities in medical school.
All right. So you obviously have, I mean, there are a lot of medical schools, a lot of options. So why this school? Why have you chosen this school to apply to, and how do you see us helping you achieve your goals?
Yeah. So I'm just going to say that you're University of Florida for this example. Um, so through the University of Florida, not only am I a Florida resident and therefore have heard all about the Gators and have always been drawn to your school, but also I'm really interested in the specific opportunities that you have that a lot of other schools don't. For example, your preceptorships have really been a draw to me. I really like being able to make one-on-one connections, whether that be with patients, with other students, or in this case, with mentors. And having somebody that I think could help guide me through, all of the different stages, through all of the years, is something that really drew me to your school, as well as the in situ training. I looked at your resources, your facilities online, and they were beautiful. I was honestly blown
Mhm.
away. I think that's something really unique that you guys offer that I would love to take advantage of if I could.
Do you have a specialty in mind that you're drawn to?
I do. I am specifically interested, well, I say specifically, I'm interested in being a generalist, actually.
Okay.
Um, Specifically, maybe in primary care. Um, I want to be able to help as many people as possible, and
Mhm.
especially through perhaps like a free clinic setting, being able to know the basics of everything, I feel I would be able to help the largest amount of people, whether it be, healing a broken arm or, showing somebody how to use an EpiPen or an inhaler. Being able to understand the basics of everything would help me help the most people.
Okay. The tests that you just mentioned, you want to do those as a physician or just as a medical student?
I'm sorry, the what tests?
The tasks that you just said, so
Oh,
EpiPen and kind of casting and things like that. That's more in line with a PA. So is this what you want to learn during medical school?
yes. So what I'm trying to say, thank you for clarifying, is these are kind of like the baseline things that I want to be able to teach patients so that they're able to kind of be more self-sufficient. And to add on to that, one of the other things I'm really interested in is internal medicine and perhaps general surgery,
Okay.
um, which would definitely be harder to do via a free clinic, depending on, funding and if I'm able to, get relationships with perhaps the AAFP to help fund it and help get other physicians involved in the project.
Okay. Playing off of that, it sounds like you're really interested in working with underrepresented and underserved communities. Understanding high costs to be one of the biggest barriers people face when trying to access medicine to begin with. Do you think it's ethical for physicians who own private practices, let's say in family medicine, to not accept Medicaid and Medicare patients?
I will be honest that I am not familiar with the laws surrounding Medicaid and Medicare at this time. That's
Mm-hmm.
definitely something that I would love to know more about and we'll probably do more research about after this interview.
Mm-hmm.
But I think as a private practice, you do have a certain degree of removal from those practices and therefore are able to make your own decisions about what insurances you accept.
Mm-hmm.
However, I believe that in order to give all patients the opportunity to get the care that they need, I personally, in that scenario, would accept Medicare and Medicaid because I want to be able to give help to anybody who may need it, even if there are hospitals nearby that may take it. If I'm in a rural area, for example, it could take an hour to get to a hospital that accepts Medicare and Medicaid, and this could be an emergency. I want to be able to accept those people and get them the immediate help that they need.
Okay.
All right. Let's see. What would you say are the three most important qualities or characteristics a physician should have?
Yeah. I think humility is a very big one. As doctors, we all go through intense processes to get where we are. And I think that understanding that not only are we going to be working with people from different backgrounds, different levels of education, different countries they may come from, understanding and respecting their lived experiences is very important. Additionally, when working in a team, which we almost always are as physicians, I could be a urologist working with a cardiologist. I don't know as much as them about cardiology. That's not my specialty. So understanding that I have to trust them and know that they're going to do what's best for the patient is really important. So number one, humility. Number two, I would say is compassion, empathy, understanding that usually nobody wants to be at the doctor. So we're here to try and help make this process as smooth and as harmless as we can and just try to help them, understand them, know that they might be upset and understandably so, and help them both physically as much as we can and also be supportive emotionally. And I would say the third one would be respect. And all of these do kind of tie in together to make somebody who is understanding and willing to work in teams and compassionate, because you can't have compassion or humility without also respecting the people that you're working with.
Pulling from your past, can you recall for me a time where you had to work with somebody who was difficult to get along with? I'd like to know why this person was difficult and how you handled them, whether it happened to be good or bad at that time.
Yeah. So at my school, we have a lab course, and this lab course is notorious for breaking friendships. I blindly went in with some of my friends, as you know, all young sophomores do, and we make mistakes. And I had a little bit more research experience at the time. I had already been doing research. I had already had lab experience. And because of that, I tended to take the lead. So during one of these days in the lab, one of our instruments wasn't getting results. So I kind of thought about it analytically, did a couple of journal reviews, and said, oh, I think I found the issue. I'm going to fix this issue. I, however, did this without consulting my lab mates. So after speaking with them, I realized that while I was thinking about things in an efficiency standpoint, they were thinking about it in a teamwork standpoint. So there was this difference of ideology in what our goals were for the project that should have been established at the beginning. Realizing this, we had a sit-down discussion to kind of reconcile what had happened, where we went wrong, and how we can improve for the future, trying to have this growth mindset of taking this experience, learning from it, and working towards making better decisions, setting up those expectations from the get-go in the future.
Would you say you were the difficult person in this situation?
I think it's very possible. I think it's not about difficulty, it's about difference and communication.
Okay.
I'm going to throw kind of an ethical scenario at you. Do you think it's ever okay to lie to a patient?
No. I think that as physicians, we have, obviously, we abide by do no harm. And it's not our job to decide what the patient can and cannot know. Our job is to work with them, communicate with them, empathize with them, and to try to find what's causing them whatever discomfort or pain they're feeling. And whether that be good news or bad news, it is still our job to inform them of that news.
Okay. So kind of
All right.
piggybacking on that, let's say hypothetically you're a physician, a colleague of yours has made a mistake in their treatment of a patient of theirs. They don't want to tell the patient. How do you handle that situation?
Mhm.
I would first go up to that colleague and say, "Hi, I understand you made a mistake. We all make mistakes. These kind of things are going to happen. But as physicians, it is our role to be honest and be humble and admit that we make these mistakes. And the patient has a right to know whatever the information was. I would really love it if you were to tell them yourself. I'm happy to go with you as emotional support if you would want that and to talk it through with the patient with you. But unfortunately, if you do not want to come forward yourself, I will inform the patient.
Would you
Okay.
escalate this to anyone?
If the physician is not willing to come forward and is not willing to admit that they made a mistake or is being difficult or resistant, I would then bring it forward. If it was just a one-time mistake, they said, "Oh my God, I didn't notice. I'm so sorry. Let's go tell them right now," then I would not.
Okay. Anything else you feel like you'd like us to know before we end our time?
I think that one other thing that I would like you to know is I had briefly mentioned that, I do a lot. I'm very involved on campus. One thing that I think is important to point out is that this did have a damper on my application. Having to work all of these jobs due to financial strain limited the amount that I was able to volunteer or do other opportunities that might have strengthened my application. In no way does this deter me or my drives or my reasons for wanting to be a physician, but I do think it's important to note that I am aware that there may be some lower numbers on my application, but that is due to financial strain.
Okay. Okay. Do you have any questions for us?
Yes. Um, what, once again, I'm kind of leaning into University
Yep.
of Florida here. Um, what, in your medical school, what is your favorite committee that the students run?
Okay. Anything else?
Yeah, I know that one of the things I'm really interested in that UF has is this equal access clinical network where you offer these, free clinics for medical students to participate in. What percentage of students are involved in this? How much interest is there in it?
Okay. Anything else?
Yeah, I guess I'll say my last question
Hmm?
is how do you feel that the medical student research program factors into overall UF Med experience?
Okay. Scene. You can sit
Take a breath.
back and relax.
You didn't die.
Yeah.
Yay!
All right. So that's about what it's going to feel like, to be honest. If you have kind of a 2-on-1 situation, we went for about 20-25 minutes there. Most commonly, you're going to either encounter a 20 to a 30-minute traditional setting and things. So how are you feeling?
I feel okay.
Yeah, good. Any
Uh,
question you felt a little bit put off by or kind of stumped by initially?
that'd be if I remembered the questions. I'm pretty high on
Yeah,
adrenaline right now, to be
that-
honest. I think
that's
there were
common.
definitely ones that I paused more on.
Mhm.
Um, I think I have like a bunch of bullets that I've been working on, and I think I was like maybe trying to find the bullet on like my desired specialty and feel like I kind of floundered a little bit there maybe. Um, yeah.
Okay, all right. Where do we start? Feedback. Okay. Um, I don't know. Kristen, you want to go first? You want me to go first? I don't care.
Do we want to walk through the questions or just kind of give
Yeah.
general feedback? What do you think?
Sure. Yeah. Let's go by questions. Yeah.
Okay. So on the tell me about yourself, couple of things that stood out to me, and I think there was an element of probably nerves. There was a lot of hand talking. I'm a hand talker, so I
Me
get
too.
it, but it can be very distracting. So I
Okay.
will have to literally clasp my hands and hold them in my lap, or I will sit on my hands
I tell people to
sometimes.
sit on them. Yep. Okay.
I will literally have them tucked under my legs so that I do not start conducting, because you don't want to look like you're conducting an orchestra and have your interviewer focused more on that than what you're actually saying. I would also say that you made a common error, I think, with this one, and that was turning this into why medicine.
Okay.
It became more about your journey to medicine and less about you. And the question was, tell me about yourself. Who is Whitney?
Okay.
And you are more than your pre-med journey. And they truly want to get to know you through this question. And oftentimes the why medicine or some version of that comes next. And so if you've already kind of answered that, it can make that transition a little hard, a little wonky, and then you start having to repeat yourself. I don't know, Courtney, what do you think?
I agree with those points. I mean, I'm a hand talker too. I'm always fidgeting and things like that. I absolutely tell people sit on your hands, don't have a swivel chair. There was a little bit of kind of like you would really adjust, and I think that energy was just kind of coming out that way. But it was pretty telling that you were a little bit jittery. But to the point of being off-putting and really problematic, probably no. But again, we're gonna give you feedback to take it from good to best, right? And so we're gonna be nitpicking things that aren't in the garbage, but can be slightly improved upon. Okay. So I agree. I don't like it when people turn it into a why medicine. Usually what I liken it to is like, think about if you're going to a speed dating event and you have 2 to 3 minutes to go around. And the point is to give somebody kind of a high level overview, a little bit about family and where you grew up, a little bit about what you're doing for school, what your interests and hobbies are, the quirks that make you you, just to give them a little bit of context, and hopefully something comes of that. The more you try to drop core competencies or turn it into your why medicine or get really creative with the format, like people, I've seen so many people try to get a little bit creative where they're like 3 things you need to understand about me: family, fitness, and blah blah blah. And it doesn't carry well. It feels very awkward. So I liken it to, if you did that in speed dating, it'd probably be a little bit off-putting if you had somebody come and approach you and do that with their introduction of self. And so help them, give them broader context of just you. I liked some of the stuff that you did bring up. I'm really glad. Obviously, I need to know where you're at in school, so I have some type of not just where you're at, but how far along you are to know kind of how to direct my questions afterwards. A lot of the time we don't see your application, even if it is open file. A lot of the times we don't look. We're going to go in, eyes shut, let me just see who you are, how you handle these things. So I liked that you shared some of your hobbies and interests. I got good context. You have a really good energy on camera. Sometimes it can be hard to convey that, or smiles completely go out the window. When the analytical face comes on, there were, and we'll kind of get to it a little bit. You may want to dial it back in some questions, but for a tell me about yourself, it was at least very personable and it had a good energy to kind of kick off. So overall, having not gotten pretty solid feedback on that, you handled it very well for an attempt.
Yep, I would agree with that.
Okay, so then I purposefully asked you the why medicine question after it because you kind of turned your first answer a little bit into a why medicine. And so I was going to play off of that and say, okay, how much depth is there? How prepared was your response? Can you still handle another question maybe worded in a slightly different way about what draws you to medicine, what your motivations are, or are you just going to literally regurgitate your script that you already gave me? And so I appreciate that you didn't do that one in the second one. You were good about tracking that it was a two-parter. Sometimes people forget. Nerves makes the other question go out of their mind. It's okay to clarify. You didn't have to clarify those, so I appreciate that you were able to recall that you needed to address both parts there. Let's see. Any other one for that motivation and burnout one?
I would say that I appreciate that you gave specific examples of things that you're doing or that that you implemented to organize your time. I felt like that gave me concrete information, but also let me in a little bit to see kind of who you are and how you operate. With saying I use Google Calendar and I'm scheduling time with my friends, and I recognize that it's important to have these social, and you mentioned physical outlets as well, and just that demonstrated that you have a broad understanding of what it takes to get through these hard things, because it will be hard. It's going to be a grind, and getting in is just the next step. It's then you start all over with school and volunteer and leadership and all the things to do it all again. So I really appreciated those specific examples that let me know that you have some skills to draw upon, that when the going gets tough, you have those to fall back on.
One question I had about that. Do you guys think it is okay that I mentioned that I have an ESA animal?
I didn't pick up on it, to be perfectly honest. It didn't cause any red flags. I don't know. I mean, we used to bring in like therapy dogs. Like, I think that's pretty common. To bring in animals to love on for medical students that just need a little bit of a break. Anytime you introduce aspects of your own healthcare, it does leave it open to being questioned, but just in that isolated incident, it didn't feel particularly red flaggy where I felt like I needed to wait, what did you say?
Wait, why do you need that? Yeah. I do. So I picked up on it, but it didn't feel red flaggy to me. I will say that I did appreciate that you said go home to my ESA rabbit. At the school I was at, we had some students with ESA animals that they tried to bring to campus. Animals were not allowed on campus, and that became huge issue. So just know that you may have some additional questioning around that. Anything that's in your application or that you share in the interview is open for further questioning and scrutiny. So I would just be prepared that if you bring it up, there may be some questioning around that. But in the way that you brought it up, it wasn't problematic, and I didn't feel like, oh gosh, there's something going on here that I'm worried about now. I didn't feel that. So
this may sound really negative, but I think there's a difference between an emotional support animal, if somebody mentions that, or if they're saying their service animal. I think an interviewer would kind of snag on that over an emotional support. I think emotional support animals are more frequently utilized or more openly utilized now. But it's a different term. There's different rights associated with it. So you'd probably, if you are going to mention it, there's probably not going to be that same level of hang on a second going on. Okay. What question are we on?
So I think we went from there to why this school, and I appreciated that you had a school in mind. I had hoped you did, and if not, then at least you pretended that you did. But I know from you submitting your form that you did have a school that you have an interview for, so I felt pretty safe in asking that question. I did appreciate that you had some very specific examples of things that you're interested in about the school. I think where a lot of people can go wrong here is kind of plug and play answers, where you're like, I like that you have clinical rotations. I like that you have an anatomy lab. And they all have that, right? But you were
Yeah.
very specific in in what you liked about the school. On some of them, you maybe could have gone a little deeper in why and how so, and how your experiences, connect with those offerings or initiatives. But again, we put you on the spot, so I think overall, not too bad.
Yeah. I always appreciate when students kind of tie it to some of their future goals or things that they want to develop, areas where there's opportunity or alignment of kind of passions and interests, because that lets me know, where am I going to find them second year of school, right? Who is this person going to be on the campus? Who are they going to be interfacing with? Who are they going to be fast friends with or plug themselves into? Where do they add value? And so I think anytime where you can kind of help them paint a clear picture of those alignment points, it's a lot more motivating than over generalization. Like Kristen said, I'm 100% on board with not liking any of those things. I don't need you to regurgitate the website back to me. I wrote those things. I just need to know why you care about those things and why you feel like you want to be part of them, or how do you know you like those things? What's the point of them for you? So I appreciated that you tied in some of your goals or some of the things that you're drawn to. And I think with giving context of the location and resources, and also, kind of the ego stroke of, you have beautiful facilities, they're amazing. Everybody likes those things. They probably agree. They probably know that they have a really great institution. And so highlighting some things that you like about it, even if it is in a physical way, is good. You weren't trying to say, you guys have really good match rates, so I want to go here. Okay. Most schools do, if not all. It's a very awkward conversation. So I'm happy that you didn't bring that up. You kept it on some more things. I would say, if anything, you kept mentioning free clinics and things like that. You may get asked a little bit about free clinics. Like, you keep bringing it up, like, why do you want to work in free clinics? What's your draw to free clinics? Like, what started that? Why are you drawn to that? Or how are you going to pay your bills if all you're doing is working in a free clinic? And is it your job to set up a free clinic? It sounds like you're even asking about funding. If you do get asked about those things, again, part of the things that we're looking for attribute wise is your own emotional regulation, right? It's not an attack. Even if I frame it as a jab, like, well, how are you going to pay your bills? I've seen it happen plenty, right? Where it feels very uncomfortable to get pushed on something. Emotionally regulate yourself, handle the question. It's not a personal attack, even if it feels uncomfortable. And so, but know that it's likely to get questioned on what the game plan is there, and if it actually fits within the role of a physician, or they're going to say, it sounds like you want to run a nonprofit. So offer it up, but have a step or two behind it, just in case they ask you how that fits into your game plan. That's what I would suggest there. Okay, I think playing off of that, we went to the ethics-based question, opinion 1, which is, understanding high costs to be the biggest, or one of the biggest barriers to accessing medicine. Do you think it's ethical for a private practice family medicine physician to not accept Medicaid and Medicare? Very common style of question to ask for an opinion on something that has the potential to be polarizing. And I think that you handled it well. I'm not sure you fully gave me an answer to the question. You turned it into a little bit of an ethics discussion, and then what you would personally do because of the needs of your area. But I didn't really fully get an understanding of your informed opinion on how you figure out or think it is or is not ethical. So it strayed a little bit from the prompt, and that's incredibly common, especially when you're just starting these questions. I've also heard people offer solutions like we should start implementing regulations on this, and people should have to see a certain percentage of the population. Let's not start that. If you have a physician interviewer, they will jump all over that because you're not even a physician yet. You're not really at a place where we should be talking about regulating physicians. I'm glad that you did not offer that up, and it didn't take a very hard course. You were careful with your wording, though. You didn't make it sound like the other side, if they didn't agree with some parts of your opinion that came up, were just awful people. They were just greedy and money hungry. But it could have been more dialed in, where you could have told me, I lean 51% this way, or 100% yes or no. And then where is that being informed from? Is it from coursework or the clinic or your own lived experience or the patients that you want to work with? And how are you evaluating kind of the ethics of it and making that decision? So that would be the feedback from that one. And those, when you kind of shift how you start addressing those, you can win yourself a lot of points with some careful wording and really hitting on that prompt. So that would be mine on that one.
Yeah, I agree with all of that. And then I would just add that, just kind of generally speaking, with these ethical scenarios, being able to respectfully give your opinion or take your stance, but then also demonstrate that you understand that people believe opposite of what you believe. So here you maybe could have said, personally, I would choose to, accept Medicaid, Medicare, but I can understand that, that physicians have a bottom line, clinics have to, pay their bills. And so I could understand that, some private practices may choose not to, if that's the route you want to go. I'm just kind of spitballing here, but just showing that you understand that people might, believe the opposite. And then like Courtney said, really dialing in and really getting to the heart of the question and answering that, because is it ethical? And I think we do have a tendency to kind of skirt those uncomfortable scenarios, those uncomfortable, hot button issues. And just remember, there's no right answer. They're not looking for a right answer. They might disagree with you. They might play devil's advocate to push you. And as Courtney alluded to and mentioned earlier, it's just about maintaining your composure. It's about showing that, hey, even when pushed, I can keep my cool. I can still respectfully, disagree, state my position, because you'll have that with, peers in med school. You'll have that with professors. You'll have that with preceptors pushing you, whether or not they really disagree. It just it comes up, patients pushing back on things. So demonstrating that again, you can take a stance, but also see the other side, or at least that people believe opposite.
Yeah, 100%. I agree. They use it for exactly that purpose. It's such a carryover to bedside manner and preparedness for that. It doesn't mean that if they introduce new information, or maybe one of their pushback questions, you're like, that's completely valid. That would change my answer. Then change course. Just say, that's a great point. I hadn't considered that when I initially gave my answer. I do think that I would take that into account, and here's how it would change. Or you can stay your ground and say, that's completely valid. I understand that. I still think, for me personally, I would stay on this side of things, blah, blah, blah. But Kristen, you do answer a question that came in at the chat, which is very common. What is the right answer for the Medicaid question? There is no correct side here. That's not the point of the question. It's not the point of the question. If it was just about you 50-50 picking the right side, we could have put that on the secondary and weeded some people out. It's the way you do deliver your answer. I need to see that you have the skill set to deliver your informed opinion very thoughtfully and professionally, and understanding these are just your thoughts. Other people may have some other ones, and not building it into something that it's not. So can you professionally deliver your informed opinion? Yeah. So good job on that one. I think Kristen, yours was next.
I think we had specialty. I think before we went there, I think that was maybe the next one that you had that follow-up question of, do you have a specialty in mind? And there was a little bit of and I think this is the one that you mentioned that you felt a little tripped up on anyway, but there was almost a little bit of a discrepancy in your answer where you said generalist, you said primary care, and then surgeon came in. And I was like, wait a minute, which one are we going with? And so I think practicing for this one, it's not uncommon to have questions about specialty, questions about where do you see yourself 10 years from now, and you've been writing these for your secondaries, right? So you draw upon that talking about your goals, what you hope to accomplish. It's okay to say that you have a specialty in mind. I think there's bad advice out there where people say, don't say surgery if you're interested in surgery, because it sounds like you're, whatever. I really think it's, be honest. Talk about what it is you're interested in and why, but also demonstrate that you have an openness to change, because the reality is half or more of medical students change their specialty of interest in medical school, because the reality is you haven't done that yet. You haven't been there acting like a generalist or acting like a surgeon. So you're totally free to change your mind, but having some level of some idea about what you might want to do and why. But I did appreciate, you had some reasons behind that.
Right.
I think I would be a little careful. You mentioned, help as many people as possible. And that almost could be taken to mean like if you're in a subspecialty, you're not helping as many people. And if I'm like a cardiothoracic surgeon, I might take issue with that and saying, what? You don't think I'm helping a lot of people, so I think just that wording, but it wasn't like, egregious. It wasn't a huge thing, but bringing in the free clinic setting. And then you did a good job of handling Courtney's pushback on, now, wait, you're wanting to do these.
Sounds like you want to be a PA.
Yep. And you did a good job of not getting yourself, flustered and lost and overwhelmed by that pushback. So good job.
Yeah.
To, I guess, ask a question. So if I'm not sure what I want to do, could I say, I'm thinking about this or maybe this, and here are the reasons why? Would that be a better way instead of saying, oh, I want to do this, oh, but also this?
Totally.
I think, yeah, I mean, you can do that if you are undecided and you're drawn in a lot of different directions. You can say that too. You can just say, I find myself being drawn to whatever I'm in. When I went and I was a scribe for this, I loved it. I was so drawn to it. I wanted to know everything about it. And when I moved over to this other job and I saw this and I saw the impact they could have on a wider range of patients, I'm invested. And so I find myself doing that a lot, which is a good problem to have. I'm so excited to learn about everything. And, initially I'm drawn to these things for these reasons, right? I like longitudinal patient care, or I like being more hands-on, or whatever it is. But I could see myself going that direction, absolutely. But, so you can preface it by saying, yeah, I love a bunch of different stuff, and I'm not concrete yet, but I am drawn to a little bit. And then if you don't have a specialty, for anybody in the chat here, you do not have to have one. Most people pick like end of third year, if we're being honest, because they have to start figuring out who they're going to make for their list and who they need to do audition rotations with. But if you know sooner than that, it can be helpful while you're in med school, just so you guys know. For some of them, you'll want to be doing research early on in school. You're going to need letters of recommendation from people within that profession, and maybe having to work within their population for the research that you're doing, or some of the elective rotations you're going to want to fill in with your electives during third year. So it's very much like applying to med school again. I think it's You have to be a couple of years ahead if you can be, is ideal. So, okay, what came after that?
Ooh, was it 3 most important qualities?
Okay.
I can't remember.
I know that we did one on conflict, the conflict question. I know I asked that one.
Yep.
We had one on that had the doctor making an error or
Is it ever
lying
okay to
to
lie?
patient.
Yep.
So we don't necessarily have to go in order. We can look back on this. Let's do the conflict one. Okay, so this is one you'll have to be a bit careful with because it sounded like you were doing your own interpretation and almost kind of dismissing the question. Where I'm saying you had to work with somebody who was difficult for you to get along with. I want to know why the person's difficult and how you handled them. You gave me a difficult situation, but the only situational context you gave me was kind of what you were doing. And you took ownership of some of the stuff that you did. You're like, I did not check with my fellow teammates. It caused a thing, which I appreciate because that is one of the characteristics I'm looking for in an answer. But number one is always going to be, do you answer the prompt that I asked or the question you want to answer, not the one I asked. So did you answer the prompt? 2, how do you talk about this person who was maybe frustrating or hurtful to you, who's really challenging? How do you talk about them while still giving me situational information? And then 3, what do you take ownership of, if anything, in the scenario? Not absolving them from anything, but what is your play? What did you do? What are you bringing up about yours? Whether taking ownership for things that were less than ideal and you know better now, or things that you tried to do that were just ultimately unsuccessful. So those are kind of the core 3 things I'd be looking for, but the answer didn't feel like it fully fit with it from my angle.
Yep, I would agree with that. And I think that Courtney's kind of follow-up question was pretty telling. Were you the difficult person in this situation? And I think that that's how that could be read was, ooh, this person might be hard to work with if this is how they're operating. And you did have the element of owning, your part in it and recognizing that, hey, we should have established this, early on. But that could have been received as, I'm not sure. Whitney might be hard to work with. She might be overbearing. I don't know how she's going to be in a group setting with peers. And we really do a lot of group work in this school, and we need our, students to be able to work together and that sort of thing. Could you have maybe, I mean, one, at its core, this scenario didn't directly answer the prompt, so I wouldn't use that in this scenario. But also, if it was a reframe to, when you maybe made an unpopular decision, or you caused a rift in a relationship or something like that, could be an example there. I would take it a step further and say, recognizing that, hey, these things should have been established out of the gates. That's how I do that now, applying that lesson learned. But yeah, at the core, didn't really answer the question and might have raised some flags or some concerns, if I'm being very frank.
Yeah.
Can you please, I think I'm just missing something. Can you please expand on what about it didn't answer the prompt?
Sure. I said a person who is difficult for you to get along with. I didn't hear anything about any individual who was challenging in this situation. You were describing a difficult situation, but I said someone who was difficult to get along with or difficult to work with. And I wanted context of why they were difficult for you. So like a person that was difficult, what made them difficult, how did you handle the person, not the situation, how did you handle the person So I wanted something a little bit more individualized and context of, because we're all going to work with people who just operate so differently than us. And some are open to receiving requests from us or feedback from us, and others are absolutely not, and they are not going to change, and you can keep your feedback. And so I was looking for someone and why and how you handled that, and assuming I was also looking for, okay, what did that change, reflecting on it, like did it push for growth, did it change, do you do things differently now, what did the end result be? But we didn't quite get to that point. Okay. We've got the doctor error or the lie one. Did those they kind of went together.
Together. Yeah.
Yeah.
Yeah. So I would say here you leaned on ethics, which is good, that it's, recognizing that patient safety is at the core of the work of a physician. And, I appreciated the reference to, we take an oath to do no harm, that, patients need to have the information that is available to them. It's not our decision to say what they can and can't know or should and shouldn't know about, their care or their diagnosis or whatever. And along those lines, you said that the patient has a right to know that a mistake had been made in their care. I appreciated that you said that you would talk to the colleague starting there and not just running right to, to leadership and saying they messed up, and it's, you said that you would talk to them, human to human, and say, what, we all make mistakes. It happens. But what we need to do is be honest. And I think the patient has a right to know. I appreciated that you said, I'd be happy to go with you if you want someone there, to support you through this. I'd be happy to sit alongside you in talking with the patient. And if you're not going to do it, I will, because I feel strongly that they need to know. So I appreciated those aspects. And then when I asked, would you escalate this? I liked that you would level with the person, like I said, rather than just running and reporting, because that's not helpful. That's not how we learn and grow. That's not how we, have collegial relationships. And yeah, so that's my feedback on those.
Yeah, I pretty much agree. I like that you tried to address it with the peer first. Again, remembering this is peer to peer, you're not the supervisor. So I was looking for an answer that acknowledged that level, or if you were going to kind of jump and put yourself above this person and tell them what to do, you need to fix it. You have to go and do this. Like, this peer-to-peer, you have no control over that person, right? So how do you handle it, right? So I appreciated the same things, right? You went and talked to the peer. You gave them grace in how you introduced the error and saying, it all happens. I noticed it. Like, just want to make sure it gets fixed, very congenially. Instead of, hey, you made an error and you really need to fix this or else I'm going to have to escalate it. I've definitely heard that answer. Don't like it. There are different ways to approach people that make them potentially more receptive to feedback. People tend to not like getting called out on errors. Human nature makes us uncomfortable. But it doesn't mean that everybody's not receptive, but how you deliver that or call it out, did you do it in front of other people? Did try to pull this person aside and say, hey, I noticed this. I just want to make sure it gets addressed. Like, I've done it before too, or, I've made errors on my stuff. I just want to make sure it gets taken care of. If we need to talk to the patient, I'm happy to go with you. So maybe giving them a little bit of context of if it would be in front of other people, is it a private conversation? Things like that would be helpful too, to show that situational awareness or that social awareness aspect of it. But yeah, I think that was probably the only thing you never want to come on, I would say, too strong. People have to do what I say in those, or prematurely escalate without trying to, again, assess the situation. What's the severity? Was it a typo? Does it need to be fixed? It couldn't easily be fixed. And what can we do right now before we make this public? We blow this up, right? So it was good to start low, and that's how you're going to want to answer those. I think that covers all of them, right?
Yeah, I think then we went to the anything else.
Yeah. Oh, yeah.
So the 3 qualities.
Oh yeah, 3 qualities. Yep.
You're right.
We did do that one.
I had no problem with this.
I didn't have any problems with the 3 qualities. You did a good job of tracking that there were 3. That one, oftentimes people will go with 1 or 2 and then they follow a trail and they never come back.
Yeah.
And we never get a second or a third. I think you did a good job of tracking that, and not only that, but you expanded, right? You gave some context and expanded. Not helpful if you're like 1, humility, 2, compassion, 3, respect. Next, that's not what we want to do. Again, giving context, giving examples. You did a great job.
Yeah, I think that's why I had no notes on it. It was one of your strongest answers for sure. You handled it exactly how you should have. So really well done. And then, yeah, the anything else you want us to know one. So I didn't have anything else on that. I think if you have an opportunity to share a little bit of context about something that you're a little bit concerned with in your application, remember that you made it to the interview, okay? So you don't want to make disparaging remarks, even if they're on yourself, to the point where you're like trying to like scramble to justify, or they're bad if I need to go back and do something, blah, 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 blah. Obviously take ownership of things, give context of things, or call yourself out for where you fell short, or, it's really challenging. But don't do so to the point where we're now disparaging on their review process and thinking like, oh, well, you guys didn't do a pretty solid job, I'm a crap candidate, right? Like you never want to put it that way. So the framework was good. I think it is helpful to understand if students have to work during school and have to balance a lot or support themselves while going to school. I think that's really valuable information. So I'm glad that you brought that forward. That gives me, especially when you said, 5 jobs. Like, okay. And supporting yourself, that's a lot. And that gives me good context of what I can anticipate you can handle in school, which is great. But not everybody has to support themselves. It does add a level of stress of this is a non-negotiable. I have to be able to pay my bills. And so that does change prioritization of things and is helpful in the context of the full review, maybe not to me in the interview, but I would definitely note it and send it up to the AdCom so that they had that level of awareness while evaluating your activity hours.
Yeah, I would agree with that. Just one point of maybe reframing. I wish I could remember exactly how you said it, but there was something to the effect of, this needing to work had a damper on your application, and that you had a limited number of volunteer hours or experiences or something like that. And I would just say reframe that and just say that, I didn't get to volunteer as much as I would have liked because, I was working these 5 jobs and that sort of thing, rather than you don't want to raise a red flag, right? And like Courtney said, you've already made it through this process. So on some level, they're okay with whatever your numbers are, be that your GPA or your hours or whatever. So we don't want to say, hey, did you notice? Like, I don't have great volunteer experience.
Yeah.
That's not helpful. So I would just maybe reframe that to say, you know what, I had to support myself through school. That did mean I was working 5 jobs, which meant my time was limited, and I didn't get out and volunteer as much as I would have liked. Really looking forward to doing more of that in medical school when I have, the opportunity to do so. then
Yeah.
you're kind of addressing it, but not saying, like, not highlighting it, right?
Right. Yeah. Positive framing can help a lot with
Yep.
that. I had to be, because I was supporting myself, I had to be really mindful about and purposeful in how I spent those few additional hours that I got to spend. And so they may not be as high as I want them because I hold myself to a high standard, but that's what I was able to do. And I was thoughtful about them given my limited opportunities to go out. Yeah, for sure.
Yeah. Then it comes across as intentional and not excuse making, which is what we don't want to do. We don't want to sound like we're making excuses or blaming or, anything like that. Just, saying, hey, you might have noticed this. Here's why. So, yeah, overall, great job.
Yeah, I really liked your questions too. I thought those were very thoughtful. I had no problem with any of them. They all stuck to the specific school. How can I integrate myself? How can I plug myself into these opportunities? All, can I be a good student? How can I be a good active member of the campus? What does that look like? Um, I usually personally warn people against dirty laundry questions, is what I call them.
I do
hate
too.
them. It's, what's something that the school doesn't have that you wish that it did? What's one thing you wish you would have known before coming here? What's a time where leadership actually listened to students and made a change? Interview day is not the day. Like, it is not the day. Or even one, I know Dr. Gray has this in his book. He knows that I dislike it. We've had a conversation about it. And everybody has a different preference, but I do not like the question, if you had a son or daughter, would you want them to come here? First off, what do you think they're going to say? No. It's such a toss away question. It doesn't give you anything. But that vein of questioning, those dirty laundry questions, if you've just tried to convince me you're fully bought in, you want to be here, you just kind of undermined yourself a little bit with that, because you're spending your free time asking me what's hidden and wrong so I don't get hoodwinked, like what other people maybe won't ask, and now I have that information. It's not a good look. It doesn't make me think that you want to be there. It doesn't make me think that you're sure. And so obviously you are welcome to that information. Absolutely. Get it with an acceptance in hand when you're parsing hairs about where you want to go. Okay. But interview day is just not that day. And that goes for when you're talking to the medical students as well. Be very careful about the questions and how you're framing them to the medical students, because they can act very casual, but they are tattletales. And they will.
They are.
They want people who want to be there and who are grateful for the opportunity, not feeling like they're better than it. What's something that you wish you would have known before you had to come here, right? They hate it. They hate it. And if they're going to be your upperclassmen and everybody's in the same pool affecting each other, I can tell you that they want somebody who is gracious and excited about the opportunity and wants to add value to the campus and appreciates what they would be willing to share with you. So be very thoughtful about questions, including with them. But yours weren't even close to that. They didn't veer anywhere near that. So you're totally fine. Okay. Well, we soaked up time pretty quickly here. Thank you for being willing to go through a full-blown mock. That's intimidating, and put yourself on display. I hope that people found it helpful. It seems like in the comments, people are liking it and that it was helpful. So shower her with praise. She did something very brave. Any other questions that you have kind of about it going from here? That can come from you too, Whitney, if you have any as well. But yeah, there's a lot of questions on like how to answer and things like that. So I don't know. Let's see. Do I have something? I've been so back to back today. Okay, I do have to go. Okay.
I do too. Yeah.
Okay. So these questions, I know there's a couple of them in here about, is it okay to not tell on the physician? What's the step process and things like that? There are steps. again, people will handle this slightly differently. I would say for this one, maybe there is a wrong answer, and it's going to be in how you deliver it, and you just really taking it and being extreme about it. Most things that are extreme in behavior or in confrontation are going to rub them the wrong way. But also, if there's a question, you caught somebody stealing at the store, do you have to tell on them? No. I've seen interviewers be 100% fine. That's not your job. You're not the store manager. You don't even work there. Like, that's not your business. So you'd be surprised with how much latitude you have to be honest in your opinions. It's going to be in the skill set of delivery and being thoughtful with your phrasing. And so, yeah, if you need to practice that, I think we were going to do something where somebody got an interview out of this. So I think that's the last thing that we need. But
Can I highlight one of the questions I see?
Sure.
And I think this is one that I personally struggle with. Is Jennifer said, where's the line between professional and respectful and letting your personality show?
It's going to differ for each person there. Again, I keep coming back to this is why you need to practice. Most of this boils down to word choice and delivery, not the opinions themselves or the personality themselves. Like, I don't want robots bedside. I am looking for some personality for sure. I do want to feel like I got to know you in it. But I'm assessing with delivery and the skills that kind of keys me in on for the most part. I can get on board with a lot of stuff. Like, as an interviewer, I'm not supposed to put like my personal opinion in on things. I can get on board with a lot if it's well worded and very thoughtfully and carefully delivered. Or if there's like sound judgment, I can see, yeah, that sounds solid, right? That's maybe not how you should do it, but I can understand that reasoning under that viewpoint. And it sounds like, following that, they were trying to be mindful about how they were navigating through it with that intention. I can teach you a law, I can teach you a rule, I can teach you a standard operating procedure. You're not supposed to know all of those things yet. But the soft skills. Okay. All right. So I need to shut this down because we need to go. We'll grab a name and then we're going to have our person contact you. And we'll continue to do these. You guys kind of set the tone for what you want, how we can be helpful. So continue to be vocal with Dr. Gray and us. We're here to help. That's why we joined Dr. Gray's, because we all want to take what we've learned and not see people essentially trip at the finish line here. And so in ways that we can be helpful, reach out to us, practice with us. We can remove, again, a lot of the ambiguity. Thank you, Whitney, for being willing to do this. This is great. Thank you, Kristen. I'm going to let you go. I'm going to jump into a cycle student and do a mock interview.
I'm about to do the same.
Students right now.
Thank you guys so much for the feedback.
Yeah, you're welcome.
Yes.
Good job.
Yeah.
All right. Bye.
Okay. Thank you all.